Here's a suction regulator. It's got 3 settings: off, intermittent, and continuous. We never set a chest tube to intermittent suction, always continuous or just off. You can adjust the suction here. We just turn it all the way up and then fine tune it on the atrium. Set up your wall suction. This is where it goes. You just take your tube and plug it in here to the thing that says suction. And then if you have a continuous suction, you'll see this orange thing open up and probably some water tidal through this compartment. If you want to adjust the amount of vacuum, you use this knob on the side and you could increase or decrease. Higher numbers is more vacuum. We normally set it to 20. That's for the... To tell it's on water seal, you take the suction off and the orange flange will come down. All our chest tube connections, we do not want to fully tape them with like a foam tape or something we can't see through, because the connection underneath can actually become undone and you not realize it. Like this. So this would be bad. You would have an air leak. To check for an air leak, you look at the fluid down here, and if you see bubbles when the patient takes a deep breath in or coughs or Valsalvas, you'll see bubbles here. The amount of air leak increases with the number, so if you see bubbles over here, that'd be a worse air leak than bubbles over here. To check to make sure the chest tube's working or tidling, you'll see this ball and fluid increase with patient respirations. Chest tube output will be recorded on the atrium. There will be no chest tube output in these suction canisters on the wall. To record them, the line that it's at will show the total output for that atrium, but you mark for your shift or that day and note the change between your marked lines that you time and date. So if it goes from here to here in 4 hours, that's 30 cc's in 4 hours of chest tube output. You do an inclusive dressing for the chest tube. You have to put Zeroform or petroleum gauze here so air doesn't leak out. So here's your petroleum gauze, and you could either use split gauze around the tube or just normal gauze like this. Then you bring the tube over close to the patient's body and you start taping down the tube. We like to use Metapore tape because it's a little more comfortable than foam tape. And try to tape the chest tube to the patient.